Hi, this is J. Emmanuel Hodge, integrative medicine physician and holistic health pain specialist. Today, I want to show you lymphatic drainage for the breast, okay? And I want to explain that the goal is to always move the lymph towards the heart, okay? And much like we did with the neck, we're going to be working away from the most distal point or the most proximal point. All right, you can do either. Typically, we go from the most proximal point towards the heart. All right, and it usually relieves the pressure. Now, note, it is not always like that. You can always go to the most distal point as well and work your direction towards the heart. All right, now for the breast, we typically work the axillary area of the arm down to the intercostal space of the rib. All right, or we can start here and work our way back. Typically, if there's tenderness, we go to the lower part of that tenderness, meaning not on it, but in front of it, and moves to allow that lymph to flow. And at the same token, for the breast, we also have in the sternum area of the chest, typically where these neurolymphatics are, or simply the sternal intercostal spaces, all right, will be tender sometimes because this area is full of lymph as well. And so we would work towards the heart typically, all right? And if tenderness does not go away, we change the direction in which we're moving the lymph. Even though lymph flows in one direction, sometimes buildup and accumulation needs to be broken up so that it can flow easily. And the only way we know that is if we've already worked the lymph in the direction towards the heart, and the tenderness is still there in a strong way, then we go in the opposite direction first and then go back in the direction we need to towards the heart to allow that release. And 9 out of 10 times it will release. All right, I'm going to utilize Brandy to show the demonstration of moving lymph from the breast area. All right, and what we will do is we will take the arm up, not high above the head, but just off to the side. All right, and we will palpate first to see if there are any tender areas. All right, any tenderness anywhere?
Yes.
Where?
I have a tender area right here.
Right here.
Yes.
All right, now this is the 6th intercostal space of the brow line. All right, actually the 4th intercostal space of the brow line, somewhere around there. And this is a typical area to get lymph blockage, simply because women wear bras and sometimes they get tight, and it causes this lymphatic flow. So we will get the breast out of the way, and typically I would go to the lowest part and then just work my way. Let's move that. Now, ideally, you want to make sure, ideally, you want to make sure that you use some oil, all right? Right on the skin, right on the skin creates a, if it's too dry, it'll feel as though you're sticking to the skin or that you're having some type of sandpaper action going on. All right, so now we can move this lymph. All right, and typically I always ask for the person to exhale. Again. Actually, the heart is this way. Always towards the heart. Okay, I'm gonna work my way up. All right, I'm gonna palpate again. Any pain?
It went
Sensation?
down.
How much did it go down? You said it was, where was it?
I believe it was like at a 4.
Okay, and where is it now?
Maybe a 2.
Okay, so it just went down 2 points. So what I usually do when that's the case, I will come down to that lower point, work it again, exhaling. With the breath, with the movement. On the inhale, I stop, exhale. Inhale, I stop, exhale. All right, and I check the area again. How's that?
Much better.
Where would you say you are now?
Barely a 1.
Barely a 1. All right, now remember, if it goes down a little, you can get it a lot. However, if it's down barely a 1, you don't really need to do any more. Okay, now that is on the side of the body for the chest. Now, at the sternal area of the body, all right, get down low. At the sternal area of the body, put some oil on that sternal area, and we check to see if there's any tenderness on both sides of the sternum. Any tenderness?
Tenderness here on this side, but not on the other side.
Okay, so tenderness on the left side. All right, now for demonstration practices, for this demonstration, I'm going to definitely get this closer. Show, even though the pain is on this side, I'm going to work both sides so that we can see. So typically, because the heart is on the left side, technically right here in the middle, all right, I work towards the heart as my client exhales. Okay. And because this is right at the heart, I will come in towards. All right, working that area. Again. It's really good when you can do it with the breath. Because the breath compels lymphatic flow. All right. And now I'm going to check. How's that feel?
Feels good. No
Feel any pain, any
No.
tenderness? No
No.
pain or tenderness. All right, so remember, lymph flows in one direction towards the heart. Now, let's say we work the lymph backwards this way. Lymph does not go back, it's blocked, so that pain would actually probably increase or stay there. So by remembering that the heart is right here, all right, working towards the heart is the best way to remove the lymph in those areas. Okay, thank you very much. So we want to make sure that if we're working on an elderly person, that we go really soft and light, and if we're working on a younger, firmer, fitter person, we go firm and slightly vigorously towards the heart.